This is LiveWell Talk on New Clinician Spotlight. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Today's episode is another installment in a series on the podcast where we sit down with new clinicians at UnityPoint Health, Cedar Rapids, and get to know them as a clinician and as a person. Our guest on today's episode is Dr. Lauren Hall, a physician at UnityPoint Clinic Family Medicine, Mount Vernon. Dr. Hall, welcome to the podcast.
Thank you for having me.
Where are you from?
I'm from Illinois, small town about 2 hours east of here.
Okay. And where'd you do undergrad?
I did undergrad at the University of Illinois, also called the U of I, which was very confusing when I first moved here to Iowa because it's referred to that as the University of Iowa.
It's a lot of Hawkeyes don't understand that their school is actually SUI, State University of Iowa, on the charter, and University of Illinois is U of I.
So I'm correct.
You're absolutely correct.
I will not start telling that to
As a diehard Notre Dame fan, I like to point that out to the Hawkeye fans. But yeah, go. I'm sorry.
You're good. So I did undergrad at the University of Illinois in Champaign-Urbana. After that, I took a couple years off. I worked and I was a medical scribe. Decided finally that I wanted to do medicine. Went to medical school at Southern Illinois University down in Springfield.
Yeah.
Mm-hmm. And then I couples matched here to University of Iowa with my now husband, Bennett, who's an OB-GYN.
Oh, and where does he practice at?
He just graduated, so technically he is not working right now.
Okay.
He is going to be starting at the university, though, in August.
Okay, cool. Did you see yourself going into primary care? How did you end up in family practice?
Yeah, great question. I didn't always see myself going into medicine. I found myself there. I always loved biology and science, ended up studying nutrition in undergrad and realized that I really liked the interface of nutrition with health. So that's how I ended up in medicine. But from there, family medicine spoke to me most because it has its foundation in preventative care. And that's one of my passions. And so that's how I ended up with family medicine specifically. In addition to preventative care, it also lets me do one of my other clinical interests, which is women's health.
So you did your residency at the University of Iowa.
Correct.
And you ended up in Mount Vernon with Family Practice Clinic. Tell me about that clinic. It seems, going way back to my friends down there, a lot of them have retired, but the clinic's growing like they have mental health in the clinic. It's a full spectrum care.
Yeah, it's an excellent clinic. I actually ended up there and at UnityPoint because of a colleague, so a spokesperson, Dr. Stein. She was my senior resident, and so I actually was interested in UnityPoint and that clinic specifically because of her. And yeah, we do a lot there. It's been a really interesting switch for me going from a tertiary care center inpatient medicine to the Mount Vernon clinic because there's not a lot around Mount Vernon. The closest even urgent cares are about 20 minutes away, either in Solon, Cedar Rapids, Iowa City. And so we get a lot of walk-ins, which I at first was not expecting necessarily, but I really enjoy those visits actually.
Did you have the aha moment when you coming from a tertiary center where you're like, wow, these doctors that work in these smaller towns do a lot of cool stuff?
Yes.
Did you have that moment?
Mm-hmm.
Yeah.
Yeah. I don't know how in the weeds you want me to get here, but just a lot of, again, walk-ins where people will fall and hit their head and they don't want to go to the ER
of course not.
Right, because it's far away. And if the tertiary care center, you're there, you get the CT scan no matter what, because if you don't, there's no excuse. The CT scanner's right there. Versus in Mount Vernon, it's more of a discussion with the patient of how high risk are they, and do you really need to tell them they have to go by ambulance, or can we try to manage this differently? Or things like, again, lots of broken bones, fractures, abscesses, procedures, suturing, lots of acute care things.
No, I've had that experience. I remember my I was moonlighting as a resident down in Ottumwa for Dr. Wayne and Dr. Blue. They were pulmonologists, and I was like, whoa, these guys are good. Because you in the training center, you think that's the ivory tower, and if you're not at the U or a big hospital, then you must not be that good a doctor, right? You have that preconception coming up of training, and it's a great feeling when you have that aha moment. For me, it really meant like I was part of something special. And I will never forget that. You mentioned women's health. What are some other clinical interests you have?
Women's health is a big one. And so what does that mean? I do prenatal care. We also are doing colposcopies, IUD removals, insertions, nonexplanons, and then endometrial biopsies. So lots of women's health. But then I really enjoy, like I said, preventative care. So I do really try to talk about lifestyle with all my patients, whether they want to or not. The phrase I use often is, I'm going to keep bothering you about this. That's my job, whether it's smoking cessation or, like I said, lifestyle changes with eating or exercise. So weight management becomes a big part of my clinical interest as well.
Well, for me, it's interesting that you had the nutrition background, because I'm of the generation, over 30 years ago, medical school curriculum for nutrition was biochemistry, carbohydrates, fats, proteins, and how we got very little.
And still today, there's very little, unless you specifically go out and seek it. It is increasing. By the time I left medical school, there was some curriculum being built around that was more applicable to patients. But I think it still is lacking to some degree. And preventative care in general is not necessarily reimbursed as well by our society, or as valued as highly by our society or the system. So it often takes a sideline. It's also preventative care and nutrition. It's hard to prove a negative. What I mean by that is, if you prevent something from occurring, like a heart attack or a stroke, sometimes it can be difficult on an individual basis to say it would have occurred had you not led a healthy life, had you stopped smoking.
It's not glamorous when you prevent illness. Rescuing someone from an acute illness is a little bit more measurable. That's a great analogy. How's the transition from academic training to in practice? How's it gone?
It's going well. It's everyone says the first 2 years are the hardest. You are and that has been true so far. You are just learning a lot being on your own and not having that person to constantly not even change your plan, because by the end of residency, mostly you're managing things on your own. But to get that stamp of approval, you're not really having that on every plan. And so it takes a little bit of time to build confidence. But like I said, Dr. Stein is at my clinic with me. So I often if I do have a question, I do have somebody to ask.
And it's an exciting time. It's it should be. I hope you're having fun.
Yeah.
Because it is exciting. Now you mentioned preventative health and women's health. Are there any other areas that you find a special interest in?
I think the weight management. That's preventive in a sense, because with reducing weight, there's a lot of other conditions that can be improved or prevented. But it is its own. Everything. It's its own visit in itself.
So you kind of grew up with the GLP-1s, kind of through training and...
Yeah, but we couldn't prescribe them because they weren't really that accessible for weight management. Pretty much only diabetes, and even now we still run into that where insurances very rarely will cover them for weight management. But before, they were $1,000 a month, which was no one ever wouldn't be able to afford that. Now they can be closer to 50 to 150 depending. That's still a very large amount for a patient. So I never ask patients to pay out of pocket. There are other medicines that we can use besides GLP-1s, but some patients they were spending $150 a month on a trainer, and so they are willing to kind of switch those funds.
The orals. What's been your kind of getting off the subject here, but since I have a captive audience, what's been your experience with the orals as far as
the oral semaglutide and tirzepatide?
Yeah, I mean, working on the hospital medicine side, haven't had a lot of patients on them. I read the other day 1 in 5 patients is on a GLP-1, which that wasn't referenced. That was social media, how accurate it is. But definitely see more in the hospital. But I know the orals are on the market now. Have you used them at all?
Yeah, I definitely use them a lot. I'd say the advantages is some patients don't want to inject themselves. And so the orals can have an advantage there. You can also stop the oral medication more easily. Once the injection's in, if you do have a side effect, you can't You can't take it out. You have to go through, 7 days of having that medicine. And then they're a little bit less expensive when paying out of pocket. Let's say $300 per month, $200 per month, $150, versus the injectables are usually closer to that $300 to $500 range. But I've had very good response. They're quite effective, and patients seem to really like them.
We see a lot of patients on them.
Yeah.
What motivates you in the clinic? What gets you there every day? I mean, you're new, so it's exciting. I think as you'll traverse your career, you'll find there are things that re-energize you.
Mm-hmm.
I know that for me, it's being around the medical students when they come by. I just enjoy that. I like the people I work with. So I've got a lot of opportunities to get re-energized each day. What for you? What kind of motivates you?
When I get feedback from a patient that I really made a difference, that I really helped them, or that they felt, even if they just felt better, if they felt listened to, that really puts a spring in my step for the rest of the day, maybe a couple of days even. And then we're taking medical students. We've had 3 this year, and that really is energizing because it kind of brings back some of the excitement of learning new things.
Yeah.
And patients seem to enjoy it too, because we tend to explain more when there's a medical student around, and that knowledge also carries around to the patient.
Yeah, absolutely. And it's good for me after all these years for someone to go, why do you do that? I'm like, well, because I always did it this way. It's nice for me to stop, and I don't know, I really enjoy that. We ask, if there's one message you could provide for patients about their health, what would it be?
Along the lines of lifestyle, I would say move, even if it's not a lot. A very small amount can make a big difference. For example, I tell patients to quote mini exercise where they do 10 squats after each meal, or they walk around the block or just down the driveway after each meal. And then think about what you're putting in your body and try to make sure it's a healthy, balanced diet.
One thing I always told patients, when you go to Target, don't try to find a close parking spot. If the weather's nice, park out by the street, and just have a nice walk to something small you can do.
Yeah.
But
you're right, though. Again, our society is built in a way that it's very difficult for us to take the time to be healthy from a lifestyle perspective. And also it's more expensive to be healthy for a lot of people as well. Like fresh, healthy foods are more expensive than some that are less healthy and less convenient too.
Isn't that crazy?
Yeah.
I mean, it really is. I went to a lecture, maybe 2 years ago, and it was a gentleman. He was doing it on, he was preventive medicine, but it was about macro foods and, the whole foods you can recognize. Okay, that's a tomato, that's an orange, as opposed to a Dorito. You can't recognize really what's in it, right? But, he had this great analogy. He said, when he was a kid, his grandmother made mayonnaise for the homemade mayonnaise, and he would have to stir it up before you'd serve it because it would settle out, And then he gave the analogy that like mayonnaise that we buy in the stores is emulsified and it stays together. And, what does an emulsifier do to your intestines? Who knows? It was a really interesting story about how processed foods are just bad.
Yeah. And it's hard because we don't have a lot of data. And one of the other things that's can be problematic in our current system is misinformation as well online, and even from providers or friends. And we just don't have a lot of data on some things. And sometimes we don't have answers for patients on some of that too.
Well, a couple other fun questions here. Your husband, Bennett,
yes.
Do you have a family?
We have two cats. 2 cats. So it's just me, my husband, and our 2 cats in our household right now. And then we are very close to our family, so we are often traveling back to Illinois to visit our parents and siblings.
Is he from Illinois as well?
Mm-hmm. Yes, oh, we met in medical school.
Oh, cool. That 2 hours is perfect.
Yeah.
It really is. Now all this is my hometown, so all my relatives are around. What are some of your hobbies? What do you do outside of medicine?
So I like to do a lot of different things. I really like art. So I will go to like a pottery class or a painting class.
Oh, wow.
I love hiking and nature. I love getting outdoors. I love eating and cooking and finding that balance between very healthy and flavorful, but still, very healthy, but still flavorful and tasty. Go to a lot of national parks. I love games, euchre. If there's a euchre tournament, I will play. I'm not good, but I'll do it. Escape rooms. Yeah.
Euchre, that's interesting. When I was in college, the fraternity, I was so bad at it that like nobody wanted to play if I was at the table, because I was just horrible at it. I have some post-traumatic stress from playing cards in college just because I was so horrible. Well, Dr. Hall, thank you for joining me. That was very interesting. Welcome to the team. It sounds like you've really established yourself in a short period of time there at the Mount Vernon Clinic. Once again, this was Dr. Lauren Hall, a physician at UnityPoint Clinic Family Medicine, Mount Vernon. If you are interested in scheduling an appointment with Dr. Hall, call UnityPoint Clinic Family Medicine, Mount Vernon at 319-895-8841. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.